Okay.
So it says the way they define conversion therapy is conversion therapy means a practice, treatment, or service designed to, and then it says A, change a person's sexual orientation to heterosexual, B, change a person's gender identity to cisgender, C, change a person's gender expression so that it conforms to the sex assigned to the person at birth, D, repress or reduce non-heterosexual attraction or sexual behavior, E, repress a person's non-cisgender identity, or repress or reduce a person's gender expression that does not conform to the sex assigned to the person at birth. And the problem with the way that this is worded is because it all hinges on one word or two words, designed to. Okay, it says a treatment or service designed to. So if a patient comes into your office and they say, "Doctor, I have gender dysphoria," and you're like, "Okay, well, let me like check that." And if through the course of their treatment, the doctor thinks, "I don't think this person has gender dysphoria," and they try to make them come to terms with their, cisgenderness, that is that a treatment or service designed to repress or reduce a person's gender expression?
No,
yes,
read the
you just
no. Read
engaged in
read the thing
conversion
again.
therapy. You're going to jail.
Repress or reduce non-heterosexual attraction, repress or a person's non-cisgender gender identity.
Right.
This assumes that they already are that gender.
No,
so if they know that, if that's established, and then they try and convince them to reduce it, that would be the conversion.
Is that assumed in the bill that this is someone who's coming to a doctor after they've already got like another doctor saying they're transgender?
Yeah, that doesn't make sense.
No, it absolutely does.
No, I understand what you're saying. I don't think
that's
what
to change a person's gender identity to cisgender. Based on these instructions, that assumes that the person's gender identity has already been to some point established. This isn't somebody comes to you with gender dysphoria or wants to be diagnosed, and then you must diagnose them. I feel like, Sitch, you were kind of being not intentionally dishonest, but I think that you were maybe misunderstanding this.
Oh, don't make me kick you, Avalon.
First of all, I'm not. Okay.
I will kick you.
Hunter, I understand exactly what your point is. Okay. But like if Mahler was here, he's saying that you're writing into the script something that's not there. No, is there a part in this law that specifies what you just said? Because I don't think there is.
If you're saying it's ambiguous,
change a person's gender identity to cisgender.
But it doesn't
that
say
rule
that
to even make sense. You have to presuppose that the person's gender identity has already been to some degree established.
That has to be in the law. What do you mean?
Yeah,
you can't just say that. It doesn't say like defined by. You have a doctor's note that says that you're transgender.
I think the scary thing, well, you have to look at the intention behind the law, and Piso can chime in here, but I'm pretty sure the scary thing is that if it's left vague in certain states, and you know how the courts are going to rule on things, and the law can be left kind of vague, and then there could be rulings that further solidify it later in the direction that it's obviously intended, which, depending on your legislature, could be a rule.
I've made the same criticism about the don't say gay law, so-called don't say gay law, which I agree is aptly named, because I think the ambiguity in that is a big problem, because I see that institutions will likely respond and do things that are extremely corrosive to gay and transgender communities. I don't honestly see the ambiguities in this law going against a doctor in the kind of case examples that you're setting out. And to the extent that that ambiguity exists, I would say that you make it more clear, I guess. But that's the only thing.
But how not? How is it not?
I feel like this is so clear, in my opinion, that they're saying that you cannot repress a person's non-cisgender gender identity.
If they don't have gender dysphoria, that's the whole point of the treatment. If they don't have gender dysphoria, isn't that the treatment that you want? If somebody has a social
then they wouldn't be.
If somebody has the social contagion instead of the gender dysphoria, isn't the whole point to repress them identifying as transgender?
Would not be the correct word. The correct word there would be to, I don't know, bring into question, maybe, to further try and understand.
But you just broke in the law.
To be this way. No, Adam. No, I didn't. Based on what these definitions say, it is pretty clear that they're talking about trying to or profiting from repressing someone's identity if they already have established that is their identity. Clearly, if somebody's coming in and says, I'm xenogender tree, okay, I'm a deer or some kind of dumb crap like that, and then you say, no, you're not actually, that's not repressing somebody's identity. Their identity has not even been established.
Wait, Avalon, I don't see where you're getting that the establishment has to be like legally documented or medically documented. I can easily imagine a scenario where like there's a trans woman who's never had any medical documentation, but for like 5 years has been trans, goes into the hospital, and then someone tries to convince her she's not trans. I can easily imagine that person trying to sue because I'm trans. I told them I was trans.
Okay, what's the remedy then? What happens if you do that? It's the cause of action. Presumably you have to show damages, right, of some kind.
Yeah, like Pisco, can you? I want to know. Am I incorrect here about this?
It would be a criminal.
People are saying I'm reading too deeply into this. I feel that I'm reading a pretty.
If I had to read, you're gonna have to. If this case came before a court, like obviously anyone can file a lawsuit and be like, you broke this law.
No, it's not. It's not civil. It's a criminal. It's a criminal.
Criminal
offense that we're talking about.
Okay, so it's a government typically would be like charging you with violating.
You broke this law, yeah.
Or telling a trans person or telling someone who you think isn't trans that they should get over it, right? Is that
that you a doctor had a person come into your office who said that they were trans or had gender dysphoria, and over the course of your treatment, you said, I don't think they do. I think this person is cisgender. And after doing that for some months, the person gets really pissed off at you and says, fuck you, you're a bigot, you're trying to convert me. And they go to the government and say, this person broke the law. They tried to convert me.
I can't speak to what like the Canadian law is like. In the United States, we have this thing called like the rule of lenity and due process, where we're going to assume criminal laws to have like, if there's some ambiguity about what the law covers, the tie will go to the defendant. Maybe in terms of a criminal law, I would be more in favor of having some more clarity on that stuff, especially how it implicates potential like free speech values of the doctor. And so on that basis, maybe you could say that the law is super weird. Do I think it's going to be a huge problem in the future? No, I don't, because I don't think that the case.
Of course, wait. This is the argument that you and all these other people are making about the "Don't Say Gay" bill. You have this vague law that basically makes it so that you have to reaffirm someone's transgender identity, and it's going to create a chilling effect. This is the entire argument.
The ambiguity is extremely strong in cases that can come up all the time. You know, how often is it going to be the case that you have a patient who thinks that, you know, what's the denominator of people who are transgender in the
every person that comes to a gender clinic that says I have gender dysphoria or I'm trans.
Now take the number of people who are transgender in the first place, which is you would agree is a small percentage of the population. And now the number of people who are sort of wrongfully making a self-assessment that they're transgender, and the doctor is going to say something that, and then a police is, you know, then someone's going to charge them from or report them to police. I think that those kind of cases are much less likely than.
Okay, well, I completely disagree. This is completely wild speculation on your part. Okay, you're going to have, this is the problem, is that you're going to have anyone that goes to a gender clinic in Canada, which the whole point is supposed to be to determine whether this person ever actually has gender dysphoria or not. And now they're going to be afraid to tell people they don't have gender dysphoria.
And how many doctors are going to be? Yeah, there's.
Okay, wait, hold on. Wait, firstly, how many? This is a totally worthless. I don't know why we're even asking this, because
I don't
even if it's like a small number overall of the percentage of doctors, we're talking about a criminal action against like a certain sector. Like I could make rules affecting cardiologists that aren't going to affect very many doctors, because it's just one, like that doesn't mean anything, right? So we should be asking about like the more like the merits of the law itself.
How often will this come up is the question.
Well, I imagine if you're in like a gender clinic, probably every single day, right? Because if I go to Florida, how often is the "Don't Say Gay" bill coming up? If you're not a teacher, you're never hearing about this ever, right? So
I'm not saying that the denominator should be all interactions ever in the "Don't Say Gay" law. I think I agree with you that it should be specific to whatever domain you're in. In the case of "Don't Say Gay" law, it's going to be schools and teacher interactions. In the case of law,
so in this case here, I imagine the argument is that I'm hearing from them. I haven't read the text. The argument is that anytime you've got somebody coming in with questions about being trans, that you're triggering your chilling effect about that law.
How often is it so like how often does a mistaken like dysphoria diagnosis result in harm?
Who knows? Who cares? It doesn't matter whether the diagnosis is bad or not.
No, it absolutely, the ultimate evil of the law, to what extent the ambiguity matters, is how much harm it's going to cause. Agree, Destiny?
No, I don't know if I do.
You do agree. If
you're shifting the argument completely.
Wait, when you say how much harm it's going to cause in terms of like quantity of people in society affected, no. But no, are you trying to get us? Okay, what are you talking about?
Okay, if there's ambiguity about whether or not a food regulation requires you to have a spork versus a fork, but something mild, or whether there's ambiguity with respect to, like, I don't know, whether you serve your sandwich with newspaper or deli paper.
Okay.
That kind of ambiguity, I think, is not as much of a problem as things that are going to come up, significantly and cause big underlying problems. If you're chilling people to have newspaper wrapping instead of deli paper, maybe it's not a big deal, or maybe there's a getting the
sure, but I think the chilling effect, yeah. So the negative effect here would be that you have a person that might have some mental disease that requires treatment, but instead of diagnosing them with that, you err on the side of the caution. You say, okay, maybe it's gender dysphoria. That's the harm, which I would argue is probably significant harm.
Potentially,
yeah, getting misdiagnosed.
Wait, hold on. Not potentially. That would be a significant harm. A misdiagnosis of that somebody's trans instead of seeking other treatment is going to be a significant harm.
You're also
thank you, Destiny.
Wait, you're also comparing something to nothing.
Well, wait,
Pico.
What was Pico's response? Do you agree that it's a significant harm?
If it happens, yes, it could be a significant harm.
Yes,
that's right.
Thank you.
Okay.
Okay. No, but see, you're comparing something. You're comparing something to nothing. You have to wait. Hang on. You're saying that this law doesn't matter because it affects so little people. But how many people are being converted that are trans that this law is supposed to be targeting?
When you have a law, you weigh the costs, and then what do you weigh?
The benefits.
The benefits.
So that's what I literally just asked.
Okay, then what do you think the potential benefits are that maybe outweigh
first of all, you've completely changed the topic. Okay?
Why?
Because the topic was, does this law suck? But you seem to be saying maybe the law sucks, but it doesn't matter because it harms such a small amount of people.
I'm saying, assuming that it's what you say and it's going to chill people into giving wrong diagnoses, I think before you come out against the law, don't you have to assess whether or not its benefits outweigh the costs? Do you think
you're making the Jordan Peterson argument, which is interesting. And that's why I asked you, how many people in Canada are running around doing conversion therapy on trans people to try to make them non-trans, or gay people to make them straight? That this is an issue that needs to be codified in law.
I have no earthly idea, but don't you think that matters?
Okay, well then that's the problem. Then why? No, because I'm just criticizing the bill in the way it's written, and it seems to be dog shit.
Well, and then also, hold on. I'm really curious here for Pisco. This seems like a selective criticism to some extent, because wouldn't the argument for the Don't Say Gay bill, well, hold on, maybe there might be a chilling effect. Maybe there might be private cause of action on some issues, but isn't that worth the potential harm of LGBT people, like molesting or attacking our children? Wouldn't that be their counter argument?
I think that's right. I think that's the right way to analyze it. Does the ambiguity here, first of all, does it serve a purpose? And is the ambiguity likely to ring in like more?
Sure, but I feel like the standard that you would apply there then is you need to show me that there are a lot of children being harmed by LGBT people.
If you are in favor of the Don't Say Gay law.
In favor of the Don't Say Gay law, yeah.
Right, presumably, yeah. And I think that if you have the standard with respect to this law, I'm not coming out in favor of this law. I haven't read this law, but all I'm saying is, like, it's worthwhile to consider, one, how, is this a plausible reading of the statute? And Hunter Avalon gave, the aim of the law seems to be getting at malicious actors who have a bad intent. Most criminal laws have a mens rea where you have to have some kind of intent level. And it looks like it's situated towards malicious conduct at getting rid of existing gender identities, as opposed to just diagnosing that you don't have a particular identity.
Okay, wait, hold on. But hold on, because I could be wrong here. Wait,
because if you look at look at the bill here, and they actually go into detail about conversations, and they say these new offenses would not criminalize private conversations in which personal views on sexual orientation, sexual feelings, or gender identity are expressed, such as where teachers, school counselors, and they also say mental health professionals provide support to persons struggling with their sexual orientation, sexual feelings, or gender identity.
But that's a private conversation. They mean not a clinic doctor situation.
No, they say mental health professionals right in the list.
The first sentence you said was in a private conversation. That means someone who's not like talking to their client, who's paying them for services.
Wait, a private conversation. You think so? This wouldn't apply to a patient client situation. Sorry, patient doctor situation. Whatever exception Hunter's talking about, you think doesn't extend to the actual professional.
That's what it sounded like he said. Read it from
you have private conversations. where you can talk about personal views on sexual orientation, sexual feelings,
right? Personal
views.
Identity. Okay, so this is,
but they list mental health professionals.
No, I understand. No, what they're saying is that a mental health professional can have a private conversation with someone and give their personal view, where they say, "I don't like trans people," and it won't be criminalized. They're not saying that someone can go to a doctor and say, "I think I have gender dysphoria," and the doctor says, "I don't think you do." Because that's not a private conversation about.
That's not a private conversation.
It says, as explained the legislative summary, the new offenses do not criminalize the provision of conversion therapy to a consenting adult when there is no exchange of money or other material benefit. Furthermore, the receipt of conversion therapy services is not criminalized, whether for adults or minors. And then the Department of Justice indicates these new offenses would not criminalize the private conversations, and that's where they
doesn't even criminalize conversion therapy.
Wait, so why would they have to ask for conversion therapy for it to be legal?
No, I think that you can still have consensual conversion therapy, technically speaking. I think it's the unconsensual conversion therapy.
It's weird. The law says as an adult, you can go to conversion therapy as long as you're not paying for it, essentially.
I thought it said something about consent specifically here.
Consenting adults, where there's no exchange of money or other material benefit. The new offenses do not criminalize the provisions of conversion therapy to a consenting adult when there is no exchange of money or other material benefit.
Wait, it says new section 320 of the code makes it an offense of knowingly cause a person to undergo conversion therapy without the person's consent. Individuals convicted under this section, let's see, the code does not define the role consent might play. Yeah, you're right that this is kind of written pretty weird.
Yeah, it's a very vague and weirdly written law.
It's not that vague, though. I don't think it's as vague as people are trying to make it sound.
No,
it's not that
victory left.
It's pretty clear about what this is saying here.
It doesn't. The truth is very nice. I do like the truth, but winning is fun too.